So I feel like a lot of people may be aware of this first study I'm going to talk about, but it's effectively that they found if you have a surgery on Friday or the weekend compared to Monday, you're more likely to what's a nice way to put it? You're more likely to pass or have increased mortality risk within the next 30 days. Now, for example, compared to a Monday, if you have surgery on a Friday, they found that there was a 1.44 odds ratio, so 44% more likely to pass from your surgery. And also on the weekend, they found a 1.82 ratio, which is basically 82% more likely to pass. Now, I kind of knew this fact, so I kind of wanted to find the study, but when I was looking for it, I found another study. And now the first one I spoke about was well, is in the UK, but it's specifically England. So the second study is actually Canadian data, and they didn't actually find the same trend. Now, they did find that more skilled surgeons would generally operate midweek, and less skilled surgeons would operate on Monday and Friday. So they wondered whether that was a factor. They also said that it could be that because the surgeon is operating, let's say on Friday, their post-op, will be on the weekend, like their post-care. A lot, the initial like 48 hours or whatever it is, will be on the weekend. And they were saying how, a lack of staff could be causing a problem if they don't have enough people post-care. Now, these are just things they're like talking about and they're trying to theorize. And in the second study, they say how, more research needs to be done. And they do reference how in some countries, they talk about Germany and Australia and how in some countries they found this trend and some they didn't. So I guess it needs to be treated, I guess each country, each healthcare system differently. Like, for example, we have the NHS here, and they might have different healthcare systems or even privatized healthcare systems in different parts of the world. So more work needs to be done. Thankfully, it's not like that clear cut, so you don't have to freak out too much if you're getting surgery on a Friday, but it's definitely something to take into account, and I think more study and more work needs to be done, from the individual like healthcare centers. Anyway, so it's quite interesting. I'll put both the studies down below if you want to check them out and give them more of a read.